Okay, so what are we doing now, Gabby?
Extended abdominoplasty.
Wow. And what do you see?
White.
Yeah. You see any bleeding?
No bleeding.
No bleeding, huh? Elena. Hey, ¿de qué color es? Es
Branco.
branco. E
Branco.
agora?
E agora a gordura amarela, não tem
Gordura
sangue.
amarela?
Sem sangue.
Sim. Não tem sangue, né?
Não.
Que bom. So here we go, and we're doing. You see the little blood vessels that we're electrocoagulating, but no bleeding. Thank you. Okay, so this is a beautiful anatomy. You can see here, down there, the rectus abdominal fascia. The little blood vessel there that we're electrocoagulating. Absolutely no bleeding here. Thank you. Okay, so this is a beautiful anatomy. This is, I don't know if you can see there's a little blood vessel here. I'm gonna grab it and I'm gonna electrocoagulate it. See? You see the white there, you guys?
Yeah.
Yeah, it's nice, huh? So it is basically burned, and notice the complete absence of bleeding when we do this. And this is a deep spot right here. This is the rectus abdominal fascia. And let's show them scarpas over here, Gabby. That white membrane right here is scarpas fascia, divides superficial fat from deep fat over here. Thank you. Okay, so look at the most gorgeous anatomy right here. This is a little blood vessel that I'm going to electrocoagulate right before your eyes. And this right here, that edge right there is the edge of the rectus abdominal fascia. It's a strong membrane that covers the internal organs, right? And so I just go right above that area and notice the complete absence of bleeding here at the Cosmetic Surgical Center of Cerrito. Incredible, thank you. Okay, so now what we're doing, that's the belly button right there, and you see this is the linea alba, and what we're doing, we're going down the linea alba. It's a line that's in the midline usually. Usually after pregnancy there is a brown line here from deposit of melanin, but she doesn't have it. She doesn't have that line. And what we're gonna do now is we're gonna remove the specimen. Notice how we're cutting with this knife, all right? This is electrocautery, nothing special about it. The only thing that's special is that it has a vacuum to evacuate any fumes, so we don't inhale, we don't breathe in those fumes, but there is no laser, there is no sophisticated instrument here, there is no radio frequency. The reason why you don't see any bleeding is because of the very unique technique that we use here. We go slow. Also the tumescent anesthesia, which has epinephrine and clamps down the blood vessels, right? And the fact that we tell the patients not to take any medications that can make them bleed, you know. Sometimes a patient is not aware that aspirin, ibuprofen, herbs, vitamins can make you bleed. So we make sure that we tell our patients, we inform them to stop those medications at least 2 weeks before and 2 weeks after the procedure. And then you can have a bladderless tummy tuck like this, right? Incredible. See, you see that? That's your belly button. And we're going to go down to the root of the belly button, right? Or their stalk is the belly button. Yeah, it's like a little tree, right? And so we're gonna go down to the, we're not gonna detach it, we're gonna down the stalk, and we're not going to cut it or anything, we're just going to isolate it from the rest of the fascia. Thank you. Carl, so you're an anesthesia provider, right? A CRNA?
That's correct.
And have you ever seen any surgery like this?
Personally, no, but Dr. Patino does an incredible job with these types of surgeries because it's very rare that you see very minimal blood loss such as this. I'm quite impressed by how much blood loss this patient has experience. It's very minimal. And it's something you don't see very often.
Yeah, right?
Yep.
The colors, right?
Yep.
Normally it's
all pink. There's no red.
No red, yeah, exactly. Thank you. O que estamos fazendo agora, Helena?
Marcação.
Marcação. So what we're doing is we're doing the marking, right, Gabby?
Right.
And so we're gonna basically remove all these stuff, right? And that she doesn't like, we're gonna make it nice and tight like that. Thank you. Okay, so now what we're doing is we're gonna excise, meaning we're gonna cut the specimen. This is a very sharp knife. It's called a number 10 blade. And do you see any bleeding there?
No.
No bleeding at all, huh? Let me show you how we do these without any significant bleeding. This is incredible, see? Look at that, see? Beautiful, huh? And cutting, and there's yellow part, yet no bleeding, see? Very nice. If you want to have a tummy tuck like this, surgery like this, please give us a call, 510-525-7999. All yellow, beautiful spot, huh? Thank you.
Okay, this is a specimen on the left side. Here you can see some stretch marks, but no bleeding. Thank you. And this is the specimen on the right side. No bleeding. Thank you.
Okay, so now what we're doing is we're finishing the rectus abdominal wall muscle plication, right? So these are the muscles in the midline. The rectus abdominal muscles is the six-pack, right? And those are the muscles that separate during pregnancy to make room for the baby to grow. And we're not going to have any more babies, so we're going to go ahead and put those in the midline where they belong. Thank you. Yes. I'm going to show you how we trim the belly button. She's now nice, flat and tight. The rectus abdominal fascia has been tightened up, you know, and like when we do a corset, like an internal corset, we're going to basically push that intra-abdominal fat in so that she is nice, flat and tight, and look at that, she looks incredible, and that's where. Okay, so look how nice, flat and tight she is, and we're doing antibiotic irrigation here, which we always do, but she's nice, flat and tight, and this is your belly button. We're gonna bring it out through new skin here in the hole that we already made. Thank you. So I'm going to show you how we do the drains here at the Cosmetic Surgical Center of Cerrito. I make an incision with electric battery, no bleeding at all. This is a mosquito clamp. I go through it, and Gabby gives me the 10 millimeter Jackson-Pratt drain, and I put it through. That looks very nice. Look at the belly button.
Beautiful.
Gorgeous, thank you. Wow, so we're done. Thank you very much. Thanks God, today's Friday. Look how beautiful she looks, huh?
Yeah, incredible.
Yeah, look at the belly button, huh? Sinking in nicely. She has some lines here and a little line here in the middle, and no liposuction. This is just tummy tuck. Thank you.